Welcome and good morning. I'd like to thank every one of you for being a part of this event. You're all a part of it. Thank you for being here. This event has been made possible by a generous grant from the Program for Writing and Rhetoric at the University of Colorado Boulder. On behalf of the Sustainability Committee, and that's, if I could name the people on the committee, Rebecca Dixon, Dawn Colley, Ginger Knowlton, Jared Kowicki, and Sarah Massey-Warren. We're very happy to host you here this morning. And it's my great pleasure and honor to introduce today's panelists. Bhar Chekuri is a Climate and Health Fellow at University of Colorado's Anschutz Medical Campus. She's a practicing family physician based in Denver. Also, she's a current National Climate and Health Science Policy Fellow at the CU Anschutz School of Medicine. Her areas of interest include the intersection of primary care, community medicine, and climate change, with the focus on health equity and systems medicine. As a fellow, she works with the U.S. Global Change Research Program, providing technical contribution to the 5th National Climate Assessment, as well as the Payne Institute of Public Policy. She also co-directs a climate medicine course at CU Anschutz and has experience teaching advocacy skills to health professional students. She's working on building a graduate medicine residency elective in climate medicine at the University of Colorado. Dr. James Crooks is Associate Professor of Biostatistics and Bioinformatics at CU School of Public Health. He's also Associate Professor at National Jewish Health and a Clinical Associate Professor at the Colorado School of Public Health. He has a PhD in Physics and a Master's of Science in Statistics from the University of North Carolina, Chapel Hill. Prior to joining the faculty of National Jewish Health, he worked for 7 years at the U.S. Environmental Protection Agency at their Office of Research and Development. His current research focuses on health impacts of air pollution, climate-influenced extreme weather events, and environmentally influenced infectious diseases. Dr. Cecilia Sorensen is Director of the Global Consortium on Climate and Health Education at Columbia University in New York. She is also Associate Professor there of Emergency Medicine and Professor of Environmental Health Sciences. Following her residency training, she completed a 2-year fellowship in climate change and human health policy with the National Institute of Environmental Health Sciences. Her work focuses on the intersection of climate change and health and how policy solutions, clinical action, and education can build resilience in vulnerable communities. She currently serves on the working group for the National Academy of Medicine's Climate and Human Health Initiative. She was an author for the U.S. 4th National Climate Assessment and serves as technical advisor to the Lancet Climate and Health U.S. Policy Brief. She's also co-editor of a textbook, Climate Change and Human Health, From Science to Practice. I could go on and on about her and tell you about how she skied Denali last year, but let's get on to hear from the panelists. They'll each be talking for about 10 minutes, and then our panel moderator will pose to them some questions that have been submitted in advance, but then towards the end, we'd like to hear any other questions that you have that don't get asked. And if you're listening over Zoom, good morning, and feel free to type questions into the chat, and we'll try to include those as well. So, Dr. Sorensen.
Thank you, Dr. Brooks. Hi, everyone. How's everyone doing today? I'm going to do a funny dance here because I have some slides to show you, but I can't turn the computer around, so this is going to be a little awkward. I just asked them. All right. So, I want to start out by asking you, who here feels like climate change is impacting their health? Raise your hand. Wow. How is climate change impacting your health? Microplastics. Is that climate change? Discussion. Maybe there's a link. Okay. Yeah. Who else raised their hand? I think I saw your hand. You did not raise your hand. You raised your hand. Yes.
Last summer, summer 2020, no one was getting colds, but I somehow got a cold because of the smoke. It was really bad here in August, September 24th.
Totally. So definitely wildfire smoke here. Anybody else think different than microplastics or wildfire smoke? Are you guys thinking of? Yeah. Yes. I don't know.
I think that climate change.
Yeah, so sort of like that existential feeling of like our world and environment is changing so quickly and we're sort of out of control of this, and we're experiencing this like sad loss of like, our environment, right? And so that's definitely an impact we experience. So, we used to be here with climate change, right? This is like the poster child of climate change, right? The polar bear, it's super sad, but this is something that's happening really far away from us, and possibly in the future. But what we're seeing more and more is that the narrative is really changing because the impacts are happening so rapidly, where we're not really talking about the polar bear anymore. We're talking about health, right? We're talking about our kids and their asthma. We're talking about how climate change is a threat multiplier for civil conflict globally, right? So the narrative has been changing. So the Lancet is like this really prestigious British medical journal, right? And they came out and they said, climate change is the biggest global health threat of the 21st century, because climate change impacts every aspect of our health. And so, when you say it's the biggest threat, people are like, well, what are you going to do about it? This is so existential. But then they came back and they said, if we tackle climate change, this could be the greatest global health opportunity, because in the same way that climate change has a negative impact on everything, the solutions that we employ to address climate change have positive impacts on everything. So what are we talking about here? Where are we in 2022 in terms of the state of climate and health? So there was just a huge report released by the IPCC, which is the Intergovernmental Panel on Climate Change. This is a group of hundreds of scientists from 150 different countries who all get together and they say, what is our best science? What do we know now about climate change? And what the conclusion was is that climate change is a code red. It's a code red for humanity. And I think that language is really important to use medical terminology, because I'm an ER doc, right? If there's a code red in my emergency room, that means a patient has lost their vital signs, okay? This is an emergency. We know that the climate change is causing widespread, rapid, and intensifying impacts globally. So just to give a couple of examples. So the IPCC, they looked at, all these different impacts on health, and they identified 11 categories of diseases, which globally comprise 70% of deaths. And what they found is that all of these are climate sensitive, meaning that as a result of climate change, the intensity, the frequency, and the prevalence of these diseases are going to change. Malaria, dengue, diarrheal diseases, which are the second leading cause of death in children worldwide, salmonella, respiratory tract infections, but then also the things that we call non-communicable diseases, so diseases that don't result from the spread of an organism. And those are things like cardiovascular disease, which result in heart attacks and strokes, right? Deaths from malignant neoplasms, so cancers. All of these things, we have very good evidence to suggest are being impacted by climate change, right? Then when we look across all these different human systems, for example, our water safety, our agricultural production and our crop production, our fisheries, what we're seeing from this chart is that the darker the circle is, the more scientific evidence we have that this is happening. The negative means like, obviously it's bad, right? So what we're seeing are impacts all across different human systems that have direct endpoints for health, including mental health, which was mentioned, infectious diseases, malnutrition, displacement, and then of course we see impacts on our cities and our settlements. We see flooding and associated damages. We see all different types of extreme weather events which affect us, damages to infrastructure, and of course the cost of this is insanely expensive. And so we have very high evidence all the way on the left there that we're having damages to key economic sectors, right? So the economic impacts of all this infrastructure damage are incredibly important, and we have very strong evidence this is occurring. Just to give you a little bit of a breakdown here. So when we look at refugee situations worldwide, we call it human displacement. In 2020, there were a total of 40 million people who were forced from their homes due to conflict and disasters. And what we find is that actually 3/4 of them, 30 million, were due to climate-related events. So droughts, extreme weather, landslides, which result from heavy precipitation, wildfires, floods. So climate change is dwarfing the impact that conflict and violence has on forcing migration. Okay, so we've got a lot of issues. This is maybe the summary take-home slide here, looking at how do we get from climate change to health impacts, right? So at the top here, we have things called climate pressures, which are extreme temperatures, more extreme weather like hurricanes, droughts. We have rising sea levels and we have extremes of precipitation. These are all the things that are changing as a result of climate change. And then those result in exposure pathways. These are the things that then affect our health, right? So we have heat waves, we have air pollution, right, from wildfires. We have water contamination. We have changes in vector ecology. Vector ecology means ticks and mosquitoes and the diseases they transmit. We've increased allergens, we have impacts on food supply and quality, and population displacement. And all of these exposures trickle down to health outcomes. And so a lot of the work that we do as I would call myself a climate doctor, is trying to understand the science between these links. How do we get from climate pressures to health outcomes? And what can we do to prevent that? So other findings from the most recent report that I talked about are that climate change is worsening health inequalities, right? So everyone is impacted by climate change, but we're all impacted differently. And what we know is that those groups who are economically and socially marginalized are experiencing and are going to continue to experience more dramatic impacts from climate change on their health. And so this is really a crisis of inequality. It's a lot of bad news, but we have opportunities, right? This report left a window for us, and a window of action, because we know that climate solutions that benefit our health and our economy are win-wins, right? So when we tackle climate change, we experience immediate improvements in health everywhere. So we know that the benefits of health far exceed the cost of implementing solutions. And we know that well-designed strategies that reduce greenhouse gas emissions have significant benefits, right? And I think that is our opportunity. This is another opportunity. The severity of climate-related health risks is highly dependent on how well health systems can protect people, right? So we don't automatically have, a wildfire and then everyone gets sick, right? There's a mediating factor there, and those are our health systems, right? So we as health professionals, or even as the lay public, we have an ability to intervene, and that's what this report is telling us. So there's two main ways in which we tackle climate change, right? Adaptation and mitigation. So mitigation, when we're talking about climate change specifically, mitigation is where we strategically work to reduce greenhouse gas emissions, right? Those are things like CO2, methane, et cetera. And then we have adaptation, which is where we try to make our systems more resilient so we don't have cascading health impacts, right? Ideally, we need to do both, right? About 10 years ago, everyone was like, we have to focus on mitigation. We've got to prevent this problem. But the thing is, this is already underway. We can't just focus on mitigation. We have to do adaptation as well. But oftentimes, they're really synergistic, which is cool. So let me give you an example of that. So if the global healthcare sector, now this is interesting, if the global healthcare sector, if you took all the hospitals, all the health systems, everywhere in the world, and you put them together, they would constitute being the 5th largest emitter of greenhouse gases on the planet. So you've got like China, India, US, Australia, and then you've like health systems. So in addition to doing a lot of good in the communities we serve, we also do a lot of harm, right? Massive supply chains, pharmaceuticals need to get shipped. We've got 24/7 operations that happen in hospitals around the world, right? It's really, really carbon intense. So we're stuck in this non-virtuous cycle, right? So in 2018, we know that air pollution emissions from healthcare just in the US resulted in a loss of nearly 400,000 disability adjusted life years, just from the emissions from our health systems. We also know that our energy use from health systems adds to over 600 million in direct health costs, as well as 5 billion in indirect health costs annually. So we're in a non-virtuous cycle whereby, we have climate change and environmental degradation resulting in poor health, resulting in more health system use, resulting in further climate change, resulting in further poor health, right? So we're in this like really nasty cycle here, right? Here's an example of what happened in New Jersey after Hurricane Ida, which was, like, we weren't affected here, but it was this incredibly powerful Atlantic storm, which initially made landfall in Louisiana, but the flooding, the extreme precipitation that happened in the New York, New Jersey area was where all the death toll was, and that was because of flooding. This is at a hospital in New Jersey that was completely flooded, right? And if we look at climate-related disasters, this is just 2021 alone of where impacts were happening all over the country, right? So this is data produced from NOAA, which is our National Oceanic and Atmospheric Administration. Isn't that right down the street? Yeah, they're awesome, right? So they compile a list of disasters that are related to climate change. And you get to make this list if disaster results in over $1 billion in damage. So we know that in 2021, there were over $600 billion in damage to infrastructure result of climate change. So just to give you kind of a scale of this. So what do we do about this? Well, we can clean up our act in the healthcare system, right? Right now, across the globe, 200 different institutions representing the interests of 17,000 hospitals and health facilities are decarbonizing, right? Like they are looking at all their different supply chains, all their different building operations, and they're saying we're going to net zero, right? These are options, and what we find is that when health systems do this, they save money. Again, sort of that win-win. Simultaneously, health systems that become net neutral also are more resilient, right? So if you imagine a huge storm is hitting an area, all the power lines get knocked out, but if you have solar panels, you're good, right? Like you can keep taking care of people who are affected by these events. So health systems that are moving towards decarbonization are also becoming more resilient. So that's that overlap between climate mitigation and climate adaptation, where we reap so many benefits. So that's where I'll leave it with you and just turn it over to Dr. Crooks.
How you doing? My name is Steve Crooks, and Cecilia mentioned that part of the job of a climate-aware doctor is to try to understand the links between climate change-related exposures and health outcomes. But climate-aware doctors, they still have to go and treat patients a lot of the time. I'm a scientist; I don't treat patients, so this is what I do all the time. I get to go in and do the science around. Okay, how exactly does an extreme weather event or extreme air pollution? How is that impacting people? Both in terms of people who've been recruited into a clinical research cohort. You may have signed up for some of those studies to make some extra bucks. But also, can we relate those kinds of exposures to rates of people going to the emergency room for respiratory diseases, or the number of babies being born in Colorado who were born prematurely, kind of big administrative data sets. So I'm actually kind of a data scientist as well as an epidemiologist, because my job is to kind of link up these exposures with the administrative data and the data from clinical cohorts. So I want to talk to you today about the relationships between climate change and poor air quality, because I feel like poor air quality here on the Front Range is kind of the most obvious thing that we see when we're like, what's the climate impact in Colorado? Probably most people are going to say wildfires. That's particularly the past couple of fall seasons, we've had just extraordinary amounts of smoke in the air. So that kind of connection, I think most people really get. But there are lots of other connections too. And in fact, there are connections between climate change and air quality in many ways. If you look at sort of the fossil fuel production, before you even burn it and release carbon into the air, you have air pollution that comes with that fossil fuel production that is bad for you to breathe. After you burn it, you're producing carbon, but you're also producing a bunch of other gases that are also bad for you. So the carbon is bad in its long-term sense, but you have a bunch of other pollutants that are bad for you kind of in the short term. And then finally, once you heat up the planet, you start getting really dry forests that produce a whole lot of smoke and they burn. So we're getting poor air quality. We're getting these poor air quality hits from many different directions when it comes to climate change. So I want to talk a little bit about probably the three kinds of pollution that we experience here on the Front Range that most other cities don't. And all of them have a relationship with climate change. So the first one I want to talk about are the direct emissions from the fossil fuel production. So that is from the wellheads. If you go out to a fracking site, there are leaks in the wells and they off-gas stuff. There are also leaks in the pipelines. And then the refining process, they will off-gas things during the refining process. So the kinds of gases that are released during those processes, or the leaks, are called volatile organic compounds. Has anybody ever heard of that? Got a few nods. Okay, yeah. So it's a really broad class of chemicals. It just means something that has a molecule that has carbon in it that tends to volatilize, that is, go into the gas phase at kind of the standard temperature and pressure. All right. So it's a really broad class of gases, and it includes a bunch of stuff that is fairly benign, Like if you're walking through a forest and you smell pine trees, you are smelling VOCs. They are not going to hurt you, right? But if you're around a lot of peat thinner all the time, you're probably going to get a headache. Peat thinner is another volatile organic compound. When we talk about gasoline or natural gas, which is methane and ethane, like we are talking about VOCs. They are all VOCs. And some of them are really, really nasty. So a lot of the oil and gas development produces benzene. Benzene we know causes cancer. We've known causes cancer for like 70 or 80 years. There's also formaldehyde that's released. The same stuff used to embalm bodies. We are breathing when we go outside. Like that can't be good for you, right? And there's a bunch of other stuff with really long, complicated names in there that, again, have like neurological problems, like give you a nosebleed, give you a headache, make you confused, cause nausea. So a lot of these have really bad health impacts. Problem is we don't regulate them in the ambient air. We do regulate them, but we regulate them at the emission source. So at the wellhead. And if any individual emission source isn't emitting that much, then the rules about regulating how tight they have to put the fittings so they don't leak are not very strong. Problem is we have hundreds or thousands of these sources, intentional releases from refining or accidental releases during oil and gas development or in the pipelines. And when you have so many sources, these gases kind of build up in the ambient air. So the regulations are really tailored toward, like the emission sources and not necessarily at protecting public health for everybody. That's a real problem. So we know a little bit about the health effects of volatile organics because we study them in people who work around them. But we don't really know about what happens to the people who live right outside the fence line from the refinery, like that neighborhood that's right next door. Because we don't study it, like we don't monitor it, so we can't study it. And since we can't study it, we can't really demonstrate that there's a health impact. And without demonstrating health impact, we can't justify the regulations. So there's, again, a non-virtuous cycle around volatile organics and human health. There is actually a bill in front of the state legislature right now that's hoping to rectify that here in the state of Colorado. Yay. But most states don't have anything like that. So it's a real problem. These things are really bad for you. And there are serious environmental justice implications because the people who live next to the refinery do not tend to be the wealthy people, right? They tend to be people who are forced to live there because, that's where the land is cheap. All right, so volatile organics are the first kind of air pollution. Then I also want to talk about ozone. Has anybody ever heard of ozone? All right, you all seen like the Ozone Action Day alerts like in early September? Yeah, okay. So ozone, there's actually ozone really depends where it is in terms of how it impacts our health. So high level ozone, like way up in the stratosphere, it's called the ozone layer. It's actually really good. We like ozone way up there because it blocks the damaging ultraviolet light from the sun. The reason you don't have cataracts now at the age of 20 is because we have an ozone layer. Like the reason you don't get sunburn within going outside in 2 minutes, unless you're me, it's because of the ozone layer. Like it's really important that we have it. But the ozone down at ground level is super reactive. And so if you're breathing it, it's reacting really strongly with the inner surface of your lung, as well as your skin and your eyes, but mostly your lung because there's so much surface area in there. And it's so reactive that it can damage your lungs. Your immune system tries to respond to it. Your immune system sort of overreacts to that stimulation, and you get this inflammatory response, both in your lung that also spreads to the rest of your body. So breathing ozone, it's really, really bad for you, but it particularly obviously impacts people who already have a respiratory disease. So if you have asthma, or if you have a parent or grandparent with emphysema or COPD, those are the folks who are going to be really sensitive on high ozone days. So by sensitive, I mean if you're breathing ozone and you have this pre-existing respiratory disease, it increases your risk of needing to use an inhaler or having to go to the ER or the hospital for some, really extreme medical intervention because you just can't breathe at all. So really, really serious health impacts from ozone. Down here at ground level, ozone is both generated by the processes involved in fossil fuel development and burning, and also generated by climate change. So the ozone forms in the presence of volatile organic compounds, which I was just talking about, and nitrogen oxides, which come from burning gasoline in cars, in the presence of heat and sunlight. So all the stuff that we also emit when we burn carbon are or when we're processing the fossil fuels, those are the things that are precursors to ozone. And then once we burn them and we heat up the planet, that also drives ozone to get higher. So we know that ozone is already higher now than it would have been in the absence of climate change, even with the same level of emissions. All right. So ozone's really bad, very dangerous for us, has a bunch of different, it is a consequence of all the different processes involved in fossil fuel production and burning. Ozone is also itself a greenhouse gas. So part of the reason that cities tend to get really hot in the summer, hotter than the surrounding areas, is because they have a bunch of ozone buildup, and ozone captures the heat and keeps it like a blanket next to the ground. So that's VOCs and ozone. And of course, the last one, the most famous one that I'm going to talk about is wildfire smoke. Now that we've heated up the planet, we're drying out, forests, particularly in the Western US. And that means they're more susceptible to fire smoke. And when that smoke comes up, it comes here, right? If it's burning in Idaho, burning in California, we're probably going to get some of it here, even if it's not burning in Colorado. So like last year, at least before, December, we basically had very few fires here in Colorado. We still had a terrible smoke season, right? Because all that smoke was coming from other states. Now that smoke is a combination of different kinds of pollution. It's, you sort of know when you see it, but it's hard to zero in on exactly what it is because each fire is a little different, depending on when it's burning, what it's burning. Once it's floating through the air, it undergoes chemical reactions. But it's a combination of particulates, which are super bad for you, the nitrogen oxides from, just like you get from burning gasoline in a car, carbon monoxide, a bunch of other stuff like polycyclic aromatic hydrocarbons, which are cancer causing. There's a lot of stuff in fire smoke that you don't want to be breathing. And clearly it is influenced by climate change. The hotter it gets, the more of that you're going to be breathing. And we've already seen that the amount of acres burned per year in the US has gone up by about a factor of 3 since, mid 80s, right? It's a big increase. And not all of that is due to climate change, but the studies that have looked at attribution of that increase have found that something like 70% of that increase is directly attributable to the drying out of the West that is itself due to climate change. So there's a lot that I have just laid upon you, and it's kind of depressing, but it's also, a lot of them we have the ability to fix, right? A lot of them are involved, relating to fossil fuel production and fossil fuel burning. And so if we reduce that, we're not only fighting climate change, we're also improving our health now. So it's not just about helping your generation as you get older and your children's generation. It's also about helping yourselves, your parents, your grandparents right now. Like the same things we do to fix the climate, fix our health now. So we can sort of kill two birds with one stone by addressing fossil fuel use right now. I guess that's it for me. Thank you so much.
I might sit. That's all right. Okay. I was going to talk to you guys a little bit about health equity and gender equity, but I'm going to just kind of play off of what Jim just talked about, just because I can't help it. I'm a family physician, and I feel like whenever we talk about a health problem, and once we identify that it's a problem, it's really important for me as a doctor to think about what you can do in the immediate sense to protect yourself, right? And this applies to everyone in the room, but particularly people who are maybe already having other health issues or that make them sort of more vulnerable to things like air pollution. So I'm just going to quickly just give you guys like a quick primer on what you can do to prevent and minimize your exposure to air pollution that is already happening. Okay, so the first thing is to think about outdoor air pollution and indoor air pollution. Okay, and if you go abroad, indoor air pollution is a really big problem, especially for women that are using like stoves with, not the best ventilation and that sort of thing. But here in the US, indoor air pollution can still be a problem, but primarily I think we think about outdoor air pollution as the biggest issue for a lot of people. So I want you guys to think about things like, okay, so obviously if there's wildfires going on, you always hear this thing like stay inside and that sort of thing. We can't do that forever. So there is evidence to show that if you wear an N95 or equivalent respirator that's well fitted, it can help, reduce your exposure. We don't have a perfect solution because we can't stay inside all the time and we can't always be wearing a mask. The other thing that you can do is you can go to airnow.gov and check the air quality, and anything under 50 is good, and anything above that, you should sort of just think about it, right? Maybe that's not the day to go train for your marathon outside. Maybe that's the day you do some strength training inside if you have access to a gym, okay? Other things to think about are, where do you live, right? So if you live in a high risk area, like if you live by an industrial facility, a refinery, off of a highway, people do, particularly if you don't have a lot of income. A lot of people live off of I-25, and actually a lot of health disparities kind of run along that, which gets into environmental justice issues. But just things to think about if that's where you or your family members live. If you can afford it, because they are pricey, you can consider getting an air purifier. But they can get pricey. But let's say you have asthma, pollen seasons are longer, you're having more flares than usual, that might be an investment for you. Or you may want to talk to your doctor about maybe, letter of medical necessity, that sort of thing. Okay. Other things that you could do. How many of you guys live in an apartment building? A lot of you, right? Yeah. Even if you own a home. So make sure your furnace and your HVAC system, that your filters are switched out at least twice a year. And you want to look for HEPA filters, so HEPA filters. People have, I think, maybe heard about what those are because of the COVID-19 pandemic, but that can help in terms of improving the air quality where you live. If you live in an apartment building, talk to your landlord about how you'd like to get those changed. Again, if you need a letter from your doctor, ask for one. And then other things that you can do are, and this is where I'll kind of get into, we talked about how climate change can kind of sort of worsen health inequities. Let's say you can't afford an air purifier, or you can, but then it takes electricity to run and that sort of thing. Then you're talking, now there's the cost of dealing with the air pollution itself, and things like air conditioning, air purifiers, and all of the, and electricity. They also, if you're not living in a 100% renewable home, you're also creating greenhouse gases by running those things, right? So other things to think about are, making sure your home is well insulated, if you can afford that, and that sort of thing. So it's a complex issue, but as a physician, I would say that if you're at higher risk, if you have underlying health issues like asthma, COPD, if you have heart disease, if you've had a stroke, if you're pregnant, if you're a child or over the age of 65, or anyone around you that is, fits into those categories, you want to think about really discussing with them their exposure to air pollution, and sort of maybe then talking to your doctor about it. Okay. I just like to throw some of these out there because I don't think these conversations are happening all the time in doctors' offices, but they really should be, because air pollution is way worse for us than I think is really recognized. And, some of you may have gone to the doctor and maybe people have talked about cholesterol meds and stuff. This is like at least twice as bad in terms of premature mortality. But there are things we can do to sort of minimize our exposure and try to improve our health outcomes. So now I'll kind of switch gears really quickly and talk to you guys a little bit about health equity. And, one area that I am really, so I'm a family physician, so I see children, I take care of gynecologic issues, I, used to deliver babies, and I also take care of the other end of the spectrum. And so things to think about are really, why are children more vulnerable to climate change? And the most obvious reason is they're literally going to breathe more air and take more breaths on this planet than the rest of us. And so the World Health Organization, this is an older statistic, but they've sort of estimated that, how many of you know someone under the age of 5? Anyway, no, yeah, most of us, right? Their burden of climate change, they're going to face more than 88% of it going forward, which is terrible, right? And Part of that is because they're going to be around longer to be exposed to a lot of these exposures and pathways and that sort of thing. They may have to be around more wildfires, they may have to be around more storms and that sort of thing. Then the other thing is children, just kind of with their physiology, their lungs are more sensitive, their immune system maybe not be as strong, particularly under the age of 5. And they just sort of respond to injury and other sorts of issues differently. And then the mental health impacts are really, really important to talk about when thinking about children, because they are not growing up in the same world that we are. And probably even most of the younger people in this room, the world that you have been growing up in is not the same as the world that I grew up in. And so that's obvious. And so the mental health impacts are real, and we're still actually learning about kind of how to deal with it in a productive way. But the most important thing that I think we can do with children is sort of acknowledge that this is happening and just sort of try to process what's going on with them. The other thing to think about is gender. And so I'll give you guys a really good example. I think there's a lot of lessons that we can learn from the COVID-19 pandemic, where we sort of saw, people say like, well, what does it look like when a healthcare system is overwhelmed because of a climate-driven exposure? Kind of looks like what happened with the pandemic. You have hospitals that are overrun and unable to really care for the demand of, what people need. And an example would be, okay, so we have hospitals that are shut down maybe because of a storm, and then you've got families with disrupted care, right, to their doctors or the emergency room and that sort of thing. And the worst time maybe for women to not have access to their primary care doctors is during a time of crisis. We know that that's when they often have higher rates of gender-based violence, intimate partner violence. They also have higher needs at home, childcare needs at home. And that's actually the time when we want women to have access to their doctors so that they can get their birth control, that sort of thing. And it's not just women, it's also other people, like maybe someone who's LGBTQI who needs their gender affirming care, right? When you're dealing with a traumatic situation, that's when you don't want your medical care disrupted. And so I think there's lessons, though, that we can learn from the pandemic. So we've seen a major expansion of telehealth services in the midst of the pandemic, and it's been a great way to offer some continuity. It's not the perfect solution. Not everyone has access to broadband, but it is a solution. And we've seen that it works for some people, and it helps equalize things, right? And so that's kind of, when I think about gendered health disparities, it really comes back to that word gender, which is a social construct which changes over place and time. And so a lot of those disparities are related to underlying inequities that women and other gender and sexual minorities may face for a whole host of other reasons that are not even physiologic. I will say that pregnancy is a uniquely demanding time for women, where they do have unique health and reproductive needs, sexual health needs, that sort of thing. And that's when we want to make sure that they have some continuity to prevent adverse birth outcomes. And then I'll just kind of end with people who are over the age of 65. This is a uniquely vulnerable group in that often they're living in isolation, or they're living particularly in a place like some places in Colorado. I don't know if all assisted living facilities have air conditioning, nursing homes have air conditioning. If you've got a hotter world and air quality is worse when it gets hotter, you want to make sure that when our community members who are over 65 are not isolated, that we are checking in on them. And then also thinking about, okay, well, what makes them more vulnerable? As we get older, our thermal regulation just isn't the same. That's number one. Often they have underlying medical conditions. They also take medications that can sort of put them at higher risk. So these are just sort of ways that inequities can be worsened by something like a severe storm, a heat wave, that sort of thing. But there are things that we can do to think about how to address those inequities. And one, include those people in planning, right? So if you don't have women and LGBTQ people and older people, like a full spectrum of people, planning out how to make, let's say, for example, a cooling shelter friendly for breastfeeding, friendly for LGBTQI people, accessible for people with disabilities. So this is where really thinking about that inclusion from the beginning can be helpful. So I'll kind of stop there. Hopefully that helps.
Thank you, Dr. Chekuri, Dr. Crooks, Dr. Sorensen. And so now we'd like to move on to your questions. We'll begin with the questions, some that have been forwarded in advance to our panel moderator. This is Dr. Dawn Colley, chair of our sustainability committee. She'll be posing some of your questions to the panelists, and then we'd like to take questions from anyone else who hasn't had a question answered, and also questions from you listening in on Zoom. Dr. Colley.
Thank you. And thank you for all of that information. Some of it tired, but all, yeah, thank you for providing us with things to actually do personally. So again, as Alex mentioned, we do have pre-prepared questions submitted by many of you in here. So thank you for that. Once we get through these, then we will open up the floor for any additional questions, and then also from our attendees via Zoom. So we have Jared monitoring that. Just as a heads up, I do have my phone. Whatever comes through from Zoom, he is going to text me the questions. So if I start checking my phone, that's what's up there. Our first three questions are specifically geared toward each of our panelists, and then we will move toward more general questions. So Dr. Crooks, this first one is for you. Outside the realm of large-scale disasters like hurricanes and rampant wildfires, what sort of impact has climate change had on wilderness and backcountry medicine?
That's for me.
Yeah, that's what.
I don't know anything
that's
about
what's
that.
listed.
That's an easy question.
Dr. Sorensen, if we could please, outside the realm.
Yeah.
That's
interesting. Backcountry and wilderness medicine. Wow. I suppose, if you're going up to a glaciated area, I suspect, with melting glaciers, you're potentially more likely to fall into a crevasse, potentially. I mean, if you're seeing sort of melting glaciers like that. I would also say, that we're seeing more unpredictable weather, right? Like just here, last Saturday was 85 degrees, right? So maybe you don't know any better. You're like, I'm going on a backpacking trip, right? And you head out with like a light jacket and like some running shoes and a couple days of food. Well, then the next day it was 20 degrees, right? And this is part of what we're seeing with climate changes, right? Like it's climate change, but we also call it like climate weirding, right? Is that we're seeing extremes that are kind of unpredictable and really all over the place. So I suppose that could impact, wilderness and backcountry medicine, where people don't have that predictability of like, what's the weather going to be like tomorrow? You think it's June, so everything's going to be great, but we're seeing so much chaos in our climate system and therefore in our weather system that a lot of things can be really unpredictable. That would be my best guess.
Thank you.
Yeah. I would also say, I think no one likes allergies and the pollen season is actually longer because of climate change. And if you're not treating it right and you have asthma and that sort of thing, like and then you're exposed all weekend, like you could put yourself into a flare. So just keeping that in mind, like going forward, being really good about treating your allergies.
Dr. Chekuri, we're going to go with you on this one. Will you please speak to the unique and vital role that you envision for physicians to address and mitigate climate change?
Yeah, so I see kids for school physicals. I see them at their 1 week well child check. I also do just physicals for people in their entire age range. And so what I really envision is that physicians across the spectrum, no matter what specialty you're in, that they understand the health risks of climate change and that they're able to communicate those health risks to our patients and communities, because that's ultimately our job. If something is putting your health at risk, my job is to tell you about it and tell you what we think we can do about it. And then you can make the decision, right? And so really, I think, as I sort of alluded to, like a lot of doctors are not having conversations about air pollution on a regular basis with their patients, but I really believe that they should. And similarly, we need to sort of, I think as physicians, be better about being able to take an environmental health history. So really taking a little bit more time and understanding, you know, where do people live? What are their occupational health exposures? You know, do they have access to clean water? Those sorts of things, which are going to become increasingly important for people. So getting that information so then we can communicate, okay, based on what you're telling me, this is kind of your risk and here's what you can do to protect yourself. And then moving a step further, thinking about what Dr. Sorensen talked about, which is if the pollution that my clinic or hospital is causing is harming the patients that I'm taking care of, it is a patient safety issue. And that's something that the community and hospitals and clinics really need to deal with. And I think physicians, nurses, anyone that touches a patient can really think about how we can improve our processes to reduce that pollution and do less harm.
And Dr. Crooks, we're going to go. How significantly does air quality following large wildfires affect the climate and public health of nearby communities? And you touched a bit on this earlier on with respect to air coming to us, or that smoke coming to us from Idaho and California, but now that we are facing our own wildfires here.
Yeah, clearly it impacts a ton. I mean, if people, first of all, the obvious thing, if people have to evacuate or if they are injured in the fire itself, there are going to be health impacts from that. If people have to evacuate, oh no, I forgot my meds, or you know, I have disrupted my continuity of care for a pregnant woman, or you know, other kinds of patients who need pretty regular medical care. That all has really, you know, can have really significant health impacts. Living near a fire but not having to evacuate, you're probably breathing a bunch of the stuff that's being thrown up, and that can be, you know, burning wood. But if it's burning, if that fire is burning through a neighborhood like here, it's not just going to be wood smoke. It's going to be all the plastics, God knows what else. Many of those things, we just have no idea what they do to you. Probably nothing good. So serious implications there. But then of course, even folks living thousands of miles from the fire source can be impacted. I mean, the huge fires that we've had the past couple of August and Septembers and Octobers in the Western US, they're seeing impacts of that in New York. Right? There's a fire in New York, it's thousands of miles away, but the smoke continues. And some of the smoke can even, like the particles in it, which are probably the most dangerous part for most fires, the surface chemistry of those particles actually changes as the smoke floats downwind. And in the presence of the other gases as well as sunlight, they can actually get more toxic. So even if you are far away from the fire and your overall like concentration dose is lower than you would have been closer to the fire, on a pound for pound basis, the air pollution you're breathing may actually be worse than it would have been next to the fire. You also mentioned climate impacts.
Yes. Yeah, the climate health of communities. Yeah. Thank you. So for anyone who'd like to answer, how can a rational person remain mentally healthy when politicians downplay and ignore this massive impending issue that could be mitigated if addressed properly?
How can a rational person remain what?
Mentally healthy.
Mentally healthy. Yeah, that's a great
You're asking
question.
the wrong people.
We're all crazy.
Okay.
No, I mean, I would say, I think that talking about it is really good, and finding community to sort of share your thoughts with. I think the worst thing you can do is sort of say, like, I'm facing this alone, right? Like, I always find, like, with my work, that the best part of my day is when I get together with colleagues and I hear Bhar, I hear Jim talk about it. I'm like, oh, thank God there's really smart people working on this, because it gives us this feeling of community, a feeling of knowing that we're in this together. And I think that's really important. I would also say, spending time in nature, right? Like, we have beautiful access to nature here. Go for walks, right? Like, spend time and realize that there still is nature. There still is so much beauty in the world. And, that won't be taken from you, right? There's always going to be beautiful places to go. That's my advice.
And I want to reinforce what you just said, Dr. Sorensen. Hope is not something that a politician gives you. Don't expect that. Hope is a consequence of acting in concert with other people. That's how you get it, by getting out there and doing stuff. And that's hard when you're depressed. I mean, it's hard for me when I'm depressed. I get depressed a lot. So, but once you have actually gotten over that hump and gotten involved and gotten in a group with other people, like it really does feel better. And I mean, we're kind of lucky. We get to like, it's hard to face this on a day-to-day basis when we work at it, but also like we kind of don't have a choice. Like, even if I'm depressed, I still have to go and do something about it because it's my job. And in a way that makes me kind of lucky because I can't run away for it and hide and just be depressed. I actually have to go out and work with other people. So it's harder, you know, just facing this all the time, but also the fact that I have to go out and work with other people means that I'm constantly around other people working on it, which does help a lot.
Yeah, I think for me, I think unfortunately the way the narrative is sort of out right now is it can feel like, well, I have to live this perfectly sustainable life to do my part to address climate change. And I mean, none of us as individuals are causing climate change. So I think removing that burden is really important and healthy. And then two, at the same time, really trying to think about, yeah, it's frustrating, like politics can seem gridlocked and you know, maybe the company you work for isn't the most sustainable, but you do have personal influence. And a lot of what we do, a lot of what I talk about on a daily basis with patients, which is just kind of healthy habits. And from a mental health perspective, what we're really hoping is that you can feel good about your personal influence and think about how you want to pick something that you want to work on that feels important to you, that you can work on with the community and just kind of chip away at it. But it is not like one person's job to solve climate change. Like,
I would say not to like underestimate your power. You know, what we've been seeing, at least in terms of trying to get health professionals involved with this, is that like the groundswell from students, from nursing students, from medical students, is what's driving so much of the change. And it's students going to their administrators and being like, excuse me, like, why aren't we learning about this, right? This has huge health impacts. And the administrators are like, whoa, you know, calling you like, are your students telling you this, right? So I think, you know, just by even asking the questions, and especially, you know, you guys will be graduating soon, you'll be going to get jobs, and, you know, they're going to interview you and ask all these questions, and you can turn around and say like, so what's this company doing in terms of sustainability? You know, you can ask those questions. And honestly, the more you ask them, the more that, you know, people higher up who maybe have this decision-making are going to start thinking about this, right? Because honestly, you're all going to be incredible candidates when you go out there because you're getting great education, right? And when you start asking these questions, things change. And so I would just put that out there to you that, you know, all your little actions add up to a lot of change. So.
If climate change impacts human health, does human health impact climate change? Is there a way that we could manage our own health that would impact the environment?
yes,
100%.
100%.
Done.
Yes.
Eating a healthy diet is incredibly good for the planet. And what does that mean? Eating vegetables. You don't have to be completely vegan, you know, like all of the things that we talk about that can prevent disease and can keep you healthy. So eating lots of fruits and vegetables, not, you know, limiting your red meat consumption, thinking about being active and talking to, and this is where it's really more of a systems issue. If you're lucky enough to live in a city where you can make use of public transportation and active transportation, using those things, all of those things are just flat out good for your health. They're also good for the planet. And so a lot of times when we're talking about climate solutions and climate justice, it's a health solution first and foremost. And so I think thinking about that is a really good way to go about this.
Yeah, and we sort of classify this as co-benefits, right? And yeah, as Bhar mentioned, you know, active transportation, like if you could get somewhere around town, Boulder's like the most bikeable city probably in the world, like take your bike, right? You know, there's bike lanes and eating a diet that's like low on the food chain, you know, so limiting your meat and then trying to source locally, right? Trying to go to the farmer's market when you can, if you can, having a garden in your like apartment complex, right? Just like dig up the dirt, and maybe they'll piss off the landlord, but maybe not, right? There's some seeds in the ground, right? See what you can grow. I mean, I think all these things, are good for your mental health, are good for your physical health, and also make a difference.
COVID-19 become increasingly common as climate change continues?
That is a very hard thing to predict. So the climate link to something like COVID-19 comes from the fact that a lot of these new diseases in humans are pre-existing diseases in other animals. And so as we are destroying the habitat of these other animals, a lot of more humans are coming into contact with those animals. And so there's greater risk of transmission and that, disease jumping from a civet to a human or from a bat to a human. So that's the kind of the obvious climate link there. There's also some issues around does climate-related air pollution increase susceptibility to a disease? Once it's already circulating in humans, what's the chance of you getting it? And there is at least a little bit of research that suggests that COVID-19 was, getting into your body through this, getting into your cells through this specific receptor on the surface of your cells. And that receptor, the expression of it, that is the number of receptors on the cell, is increased in the presence of air pollution. Like there have been experiments even before COVID showing that. So I don't think, air pollution is not driving COVID transmission. That's interpersonal interaction, but it does maybe have a little bit of an influence on increasing transmission risk.
Also mortality risk. So there's been some studies looking across counties that have chronically elevated air pollution levels, and they had higher rates of COVID-19 deaths, right? And again, it's because the chronic exposure to air quality kind of affects your heart, it affects your lungs, it affects your entire body, and makes you more susceptible to just getting super sick when you get a virus.
I think this leads us into this question. What is the most critical gap in how the climate and health crisis is being addressed? Or not?
Well, I'm biased, but so I direct the Global Consortium on Climate and Health Education. And I would say that the education of our health professionals is the gap that needs to be addressed. So, you're looking at we were kind of climate doctors, right? We are a weird, rare breed. There are not a lot of us, right? And, based on sort of what we've explored today, climate change impacts everyone's health, right? So why aren't doctors talking about it? Why aren't nurses talking about it? That's an education gap, right? And so where I sit at the Global Consortium, we advocate for education among health professionals in regards to climate change. So right now we have 260 health professional schools in 40 different countries who at their highest level of the school, their deans and their heads of school have pledged to train their health professionals, which is awesome, right? So we're reaching about 200,000 health professionals annually, and we continue to sort of grow. And so I feel like the critical gap here is getting education into the hands of people who can make a difference. And, surveys that have been done looking at doctors and nurses, even across, many different countries, show that most of the time doctors are like, yeah, this is clearly a problem. Like we're seeing impacts in our communities, but many of them express that the gap is they're like, but we don't know what to do about it. And we don't have any education. So let's get it out there. Let's educate people. Let's change this.
And I love that, talking to, getting the message out to the medical professionals, and then also getting it out to the patients and patient advocacy organizations. Because there's a lot of focus in sort of patient advocacy around cures for diseases or treatments for diseases. There's not a lot about okay, I have COPD, which is a chronic disease classically of smokers, but when you have it already, the air pollution can exacerbate it. There's not a lot of emphasis on being okay, well, what can those people do to protect themselves from the other kinds of exposures that they have? And how is climate kind of reinforcing some of those exposures? And that's really unfortunate because, we know there have been research showing that fossil fuel related air pollution emissions are causally influencing 12% of mortalities in the United States, 500,000 people a year who are dying indirectly because of air pollution exposure. That's almost as many as died of COVID the first year of COVID. And we just don't see it because it never goes on a death certificate, right? There are so many groups of susceptible people out there whose health is being made worse by climate and poor air quality and just don't know it. And we need to be able to connect those dots.
You can help, you can ask your doctor, like, I'm really worried about air pollution, put some pressure on them. Be like, oh, and you can join the consortium. I think the more we talk about it, the more things change. Yes, sir.
Yeah, no, I think I'll give you guys an example. I finished my residency training about a year ago, and I will say that when I started medical school, I was probably one of the classes of medical students that was really advocating that we teach more gender affirming care that was specifically geared to and met the needs of LGBTQI people in the US. And now, just in 7 years, that has really paid off, because now I am interviewing for jobs, and the question that I get is, how will you teach this at an interview, right? And so that's kind of I think where we are with climate change and health education amongst health professionals. But I think I agree, it would be great if patients asked about this, because then your doctors have to look it up.
I think this kind of goes with what Dr. Chekuri was just saying. So who do you think will be most impacted by how climate change affects human health? Are there particular generations or demographics who are most at risk?
Yeah. Pediatricians are sort of leading in this field, I think, because this affects their patients the most. So I think if you take care of children, you've got to know about climate change, and you've got to know how to talk to patients about it and how to deal with it. That's clear. I think I like to play a game when I'm giving a talk to medical students, because they're usually at that point, there's a room of people going into all sorts of specialties. And I sort of throw up every single medical specialty up on the board, like a Jeopardy board. And I say, all right, guys, pick some and let's talk about climate related impacts. And really what that gets at is, like, even if you're an OBGYN, this is something that matters, because we're talking about prenatal outcomes and then some of the other social stuff that I mentioned earlier. If you take care of older people, that's just about every medical specialty except pediatrics. And you still have to, think about this. If you take care of refugee patients, which a lot of people in Denver, actually, a lot of doctors do take care of a refugee population. If you take care of undocumented workers, a lot of those people are working outdoors. If you across the socioeconomic demographic, if you've got people working in industries where they have higher exposures, then those are all things to think about.
And if you think about it, the people who are dying today from climate change tend to be the older folks who are least attuned to that issue. And it's amazing to me, like, why AARP is not doing more stuff on climate change. I'm like, you're the ones who are dying of it, y'all, come on.
Yeah. That's going to lead us into this next question, which is, my parents don't believe in climate change or the connection to human health. How might I convince them otherwise?
Well, wildfire smoke, I bet you. So that's your wedge issue. That's your entree into talking about it. And maybe, don't say the buzzwords that are going to set them off. But you talk, oh yeah, smoke is a lot worse than it used to be. That kind of thing. So, come at it. Maybe a frontal attack is not going to work, but you can kind of work a little bit of good knowledge in there, kind of on the sides around issues that pretty much anybody in the West is going to care about. That's what I would say.
Yeah, I totally agree. I mean, I take care of patients that maybe don't believe in vaccines. I'm not going to argue with them about that, right? I usually find ways to connect with them about what they do care about. So it sounds like you're coming in because you care about your health and you don't want to have this infection. Let's talk about ways that we can, try and prevent it. Let me give you my expertise. That's not enough. Let me give you some additional resources. And I think if you approach your conversations with anyone really about this stuff, not going into it as they don't believe in what I believe in, and think about what do we have in common. Because most people do care about their health and they are aware of these wildfires and they don't want to get sick from it. And so if you can just address it there, often the solution is a climate solution, right? Whether you call it that or not.
I do also want to say, that doesn't mean you shouldn't talk about climate change. we need more people normalizing talking about climate change in the broader society, because repetition convinces people, even if that shouldn't work, it actually does. That's why propaganda works. So it's okay to do propaganda. That's for a good cause.
That's why marketing works, right? Like they just show you those cute boots like 4 times before you actually click it, right? Like, and marketing people have figured this out, right? So I mean, I think the more people hear it, the more people start thinking about it.
It's just when you're talking one-on-one to somebody that maybe you want to be like, okay, I want to sort of figure out what we have in common before.
Talk to people about their pets.
Oh, nice.
I worked with someone that clearly we were on different ends of the spectrum when it came to climate change, but she had pets, she had horses, that was something she cared about, and the impact of the environment on her pets was clear to her. And so talking about those solutions was a great way to just talk about something that she cared about and I cared about. And so I mean, I think there's more that you probably have in common with people related to the environment and health than you think, because it's literally everything we breathe and do.
I think the broader thing here is, we're in this really funny country, like the US, where we have this climate change is a bipartisan issue, right? It's really divisive. If you go to like nearly any other country in the world, nobody denies climate change. Nobody does. It's just like, yes, this is a huge issue. And yeah, there's a lot of political issues to overcome in terms of having a clean energy transition, but it's not like this denial thing. Like, so I think getting outside the US and experiencing that can be super refreshing, honestly.
So a lot of what we've been talking about has to do with companies, governments, institutions. And this question gets more to our personal choices and how we are contributing. So to what extent do our choices in personal care / body products contribute to air pollution in our communities?
Not a lot. Certainly, like there are, hairspray and there are other body products that emit those VOCs that can be influencing ozone formation and things like that. I would say the climate impacts of those are relatively minor compared to, I don't know, millions of cars on the road, that kind of thing. So personal care products, they may be they may have environmental impacts in other ways, but the climate impact is probably not too big.
I would say like the plastics issue and the packaging is really the big thing here. Like why does shampoo come in like a bottle and then a box and then with plastic around the box, right? Like all you needed was the shampoo, right? And so I think when you're looking at sort of packaging, that's one thing to sort of think about. And sometimes there's options like this bottle has less packaging than this one, or this one's packaged better, like it's not in plastic or it's in like, recyclable plastic or things like that. And, I would also say that, there are definitely a lot of ingredients that go into personal care products that a lot of them don't have known really biologically active profiles simply because we haven't studied them. So I'd say, sticking to stuff that's as clean as possible is probably the best thing for your health.
There's a lot of confusion about labels. What is clean beauty? What is, organic mean? What does natural mean? The words clean and natural typically are not as regulated, but organic, there are standards both federally and globally. And so in the US, probably the one that's most widely used is USDA organic. And the benefit to that from a climate perspective is reduced use of fertilizers, which can impact your food and water quality and worsen soil content. Not everyone can afford those. So I think an important thing is, again, going back to, it is not your burden, but you do have some personal influence. And a lot of that is making some choices where you can, talking about it and doing the things that you care about.
So the last question before we open it up is, I'm going to read both of these out because there is some cynicism in each, but I think that it's also, it's looking for hope. So the first is, it is obvious that we cannot stop global warming overnight, and especially with people who don't believe or care about climate change. How can we all work together to prevent it if the majority doesn't feel the need to change what is inevitably in front of us? And then the second is, I've been reading a lot that the window for doing anything to prevent climate change is already closed. Not to sound cynical, but why should I care about this if the conclusion is foregone?
Well, I would say that 10, 15 years ago, the most likely outcome of climate change by the end of the century was going to be 3 to 3.5 degrees Celsius global surface temperature increase above baseline. Now we're looking at 1.9. It would be nice to be below that. It would be much better to be at 1.5, but that's a big improvement. And that is even with very divisive politics in the United States. So a lot of good can happen globally, even in the face of a lot of resistance. So even though climate change is, is not our progress on it is not where it needs to be. We've kind of removed the scariest scenarios already because of action that the world has taken. Right. So even if we're not down to like the most hopeful scenarios, we have essentially eliminated from probability the worst ones. So that's real progress that's happened. So it's not like we're helpless. Like we are making progress on this every day.
I would say that, and on top of that, like every decimal point of a degree of warming matters. Okay, so we have an opportunity to limit the extent of the climatic changes. Now, there's going to be sort of thresholds and tipping points which we pass, right? Where if we warm to 2 degrees, a lot of coral reef systems we know are going to die. A lot of biologic changes and ecosystem changes are going to happen. But that doesn't mean we should just be like, just like let all chaos ensue, because if we don't do anything, we could be looking at 6 degrees of warming, which is really, really scary, right? So every decimal point, every like 100th of a decimal point matters with climate change. Like we cannot give up. There's no like, oh, doom and gloom, it's over. It's like we have continued opportunity. We will for the next 100 years to limit the extent of warming. I would also say that, most people in America, the latest studies show out of Yale Climate Communication Center, that most people in America actually believe that climate change is real, that it's caused by humans, and that it's happening right now. And if you did that same study even 10 or 15 years ago, it would look different. So, it's not actually true that the majority of people don't think this is happening. The majority of people do think this is happening, and that's in the US. Now, is that going to trickle down to influence our policies? That's a different story. But if you're walking down the street, chances are most people around you do feel like this is a problem. And if you were to go globally, there's even more unanimous agreement. The question where we're stuck politically is who's going to pay for this, and how are we going to shift power dynamics, right? Because as we're thinking about doing a green transition, that's really threatening to a lot of people who have had a massive grip on global power for a very long time in terms of fossil fuel companies and the policies and the politicians that they influence. And we're talking about doing away with that power structure. That's super threatening, and people are hanging on to that. They're clinging to it, right? And so it's not an issue, I think, of the populace. It's an issue of larger power structures that need to be disassembled.
Yeah, I totally agree. I think there's not a lot of climate deniers in this country. And particularly, I think this group of people, you're all interested in helping sort of tell the story about climate change. And I think it's important that you know that, because we don't need to amplify that voice. It's not even existent. We can actually talk about solutions and have a more productive conversation. And I think that's, we're seeing the media start to shift in that way. And there's every year, that I meet a younger person, there are more people that care about this, that this is important to them, and that they are thinking about creative solutions. And I will say, the national conversation is very different than the local, regional, and state, city level conversations. And as an example, Colorado has a really detailed climate action plan, and that can serve as an example. And that's a great way for, I think, all of us to get involved, because we may not be able to shift this, things in Congress, but you probably can in your city council or state legislatures.
I've got one question from Zoom. This is Miriam, who asks, what are some of the ways climate change affects our food supply? Could it impact the nutritional composition or value of our food?
Yeah, absolutely. So what we're seeing is with rising CO2 levels, it impacts the amount of protein in certain grains, for example, millet and wheat. So it just has to do with the stoichiometry of how plants are made from drawing down gases from the atmosphere and pulling up nitrogen from the soil, in that when you have higher CO2 levels, you have less protein in plants. We're also seeing changes in the micronutrient composition of food as a result of rising CO2 levels.
Plus, the changing climate puts stress on the growth of the plant, particularly like the heat, the extreme heat means you're probably going to have more crop failure. So the overall food supply is probably going to diminish. Who knows what will happen, but it'll certainly put downward pressure on the global food supply, particularly in a lot of food comes from countries that don't have great governance or that are in very climate sensitive places. I mean, think about the Central Valley of California, where a ton of food, like a huge percentage of US food supply comes from that, they're having a drought unlike any that, we've experienced since, Western colonization of the Americas. So we don't, that's going to put a lot of stress on the food supply there. And you can look, Ukraine, like governance issues around Ukraine are disrupting food supply because, Russians decided to invade. But, a lot of the food that comes from a place like Ukraine is, going to countries that have kind of overpopulated from what their local food supply can produce. And so if you take, Ukraine away, those countries are like, oh no, what do we do? And if they're also undergoing a drought, you can see that food supply globally is going to be really, really, really stressed.
I think we also have to think about workers, so there's a lot of evidence showing that heat stress. So if you're an industrial agricultural worker and you're out cutting sugarcane all day, every day, and now the temperatures are extreme every day, that causes a lot of injury. And we're seeing this, it's called the chronic kidney disease of unknown origin. It's become pandemic. We're seeing it in Central America and India and Sri Lanka. And it's really young workers between the ages of 20 and 40 who are going into end stage kidney failure, like requiring dialysis. And we're trying to figure out it's unknown origin, but what we're thinking is that it has to do something with repetitive heat stress and dehydration among our workers. And so there's been a lot of evidence looking at, how extreme heat is impacting worker health and also worker productivity. So we know that every time there's an extreme heat event, what does a worker do? They have to take more breaks. They don't work as hard. And so the production decreases. And so we're seeing massive economic impacts from that across the US and across the world. So it's impacting people's health and therefore the productivity and sustainability of food systems.
I will say if everyone in this room and, the country has worked towards eating half a plate of vegetables with lunch and dinner and 2 pieces of fruit throughout your day, that is a climate solution. And that helps protect our food and nutrition security. And so, some of the solutions are really kind of simple and manageable and already good for you and stuff that we've all known about since, we were school age. And then the other thing to think about is, particularly when we're talking about agriculture, I think it's important to talk about sort of indigenous and traditional knowledge and really empowering some of those voices in those communities, because a lot of times they have cheap, common sense solutions that can help sort of protect the integrity and quality of our food and water systems. And they also happen to be a particularly vulnerable group. So it's just something to think about.
And I would say that the biggest piece of propaganda that's been spread is that it's too complicated to find solutions. And I think we have to do away with that mentality that oh, well, there's just too many, we don't know if these solutions are good or bad. It's we have solutions and we need to get away from that thinking of this is too complicated, right? It's not, right?
We do have time for a couple of questions.
Talked a bit about disproportionate impacts, and so how do you I guess for example, if someone lived Commerce City right next to their refinery, how do you talk to them about mitigating the effects of health when it's
Yeah, I do it all the time because I work in a clinic where I take care of a lot of patients that probably have a disproportionate impact, that they feel a disproportionate impact. And, one of the first questions I ask, particularly anyone that comes in with a respiratory complaint or at most physical, they say, do you live by a highway? Where exactly do you live? Do you live in an apartment? Is it old? Is it new? Lead exposure, those sorts of things. So one, I think I have found that taking the time to ask my patients about their environmental risk factors is something that they appreciate. And then really sort of, because a lot of times they have a suspicion that their water is dirty and that the air they're breathing is dirty and that sort of thing. And so they're almost relieved that I'm taking the time to talk to them about this. And then we try to think of some creative solution. So this is where I think the systems-based solutions need to catch up, and social workers need to learn about climate change, and really the entire health system needs to learn about climate change, because there have been times when, it's not always easy to ask someone to switch, just move or switch their job. But once they know what their risk is, they can try to minimize it. Sometimes they wear a mask during certain times. Sometimes, there's creative solutions. Like let's say you can afford an air purifier, but you can't run it all the time because the electricity is too high. If you have an underlying condition, I might be able to write them a letter of medical necessity, as an example. Alternatively, you may want to say, okay, well, on the days that air quality is really bad and you're feeling it, or maybe it's while you're cooking or while your appliances are running and you just run it during a certain part of the time. So I think they're not perfect solutions by any means, but I think the first part is starting to have that conversation, even to realize what these problems are, because if you're not having them, then it's just being ignored.
That's great.
Yeah, I mean, you were talking about the Commerce City and the folks who live near Suncor and all that. They're kind of the best intervention that you can offer them is like, there are organizations in those neighborhoods right around Suncor that are getting heavily involved in issues around the VOCs and the air toxics and the emissions from Suncor. And I mean, long term, the best thing we can do for the health of people in that neighborhood is make the emitting sources stop, right? I mean, you can't wear the mask is not going to help against some of the emissions. It'll help against certain things, but the VOCs is probably not going to do a lot. So the best intervention is the one that's a political intervention for that group. And there are a lot of groups from that area who are very involved in the air toxics bill in front of the state legislature right now, which is fantastic.
Yeah, and I believe there's real value though, and as physicians being able to talk to communities about this, because then they are saying like, well, my doctor said that this is bad for my child's health and I need to do something about it. So it helps push the narrative again from that polar bear to like, this is about Mary, 5 years old, having 6, ED visits.
I know when I first started in healthcare, I was shocked by the number of toxics and all that stuff. But it's essential for protecting the health of the patient. And a lot of times these emissions are possibly impacting aren't getting as much health care as other kids. So I was wondering if any of you knew what.
Yeah, that's great. And there have been some good studies which show that there's no change in infection if you use a disposable versus a reusable. And I think that a lot of this has been pushed on health systems to move towards disposable because the companies that sell it make more money out of that. And they're going on this line, well, it's safer, which is actually has not played out with good science. There's a huge initiative going on right now through our national academies of medicine to come up with strategies to decarbonize our health systems. And it's a shifting field. We need a lot of advocacy from health workers. If obviously you're a health worker, so thinking about how you can get involved, who you can talk to about it, and then also how can we have strategies that are effective to respond to it, right? How can a health system decarbonize? Well, we're building the science to understand that, and we're building the databases to be able to track that. Right. And so I think we're working hard to get these structures in place so that health systems have options and they know exactly what to do. Right. But I think as a health worker, your opportunities are, does your hospital have a sustainability person? I know a lot of them do. They'd be so excited if somebody knocked on their door and feel like, what can we do about this? Even within a department, I work in the ER, right? There's really basic stuff that can be done. For example, there's the red biohazards waste bin where you really only need to put things that are very specific, but oftentimes we just throw anything in there oh, this gauze had a little bit of blood on it, throw it on the biohazard. It actually doesn't need to go in there. And that disposing that waste uses 10 times as much energy as just the other types of waste. So even like waste sorting is something that you can do. So I would say, talking to people within your department or within the area you work and think about those simple solutions. And then, take it up the chain a little bit, talk to your sustainability person, see what you can do about it. That'd be my thought.
Yeah, there's a great organization called Healthcare Without Harm that Dr. Sorensen referenced, which they have like roadmaps and you can join their sort of organization. And one way to do that, if you're not like the CEO of that hospital, is to really talk to, your colleagues and talk to your supervisor and sort of, slowly kind of push it up the chain, or think about quality improvement as a way to improve, just again, thinking about it in terms of patient safety and that sort of thing. And then some sort of low-hanging fruit are like food procurement, like just making it the diet in your hospital healthier, meaning more plant-based is better for the environment. And shocking, right? Like, why would we have unhealthy food being served in a hospital that's also bad for the environment? So this is kind of, there's some really simple solutions.
So you guys had expressed, since you guys are physicians, that the lack of education for those physicians now. Have you guys thought about like standardizing a way for especially this younger generation coming into these physicians, like maybe involving it on the GRE or the MCAT, or even part of the curriculum where it's almost a requirement for medical schools or PA school, even like a nursing program? Kind of like how physics 1 and 2 is, or like Chem 1 and 2 and all those.
Yeah. Oh, absolutely. I mean, we're working so hard on this because, it's if people aren't tested on it, it's hard to get people to learn it. Some people, right? And so, working very hard with, the American Academy of Medical Colleges, with the Association of Schools and Programs of Public Health, with the American Academy of Nursing Colleges, to try to get these types of pieces of education to be mandatory, right? And it's hard. So, to get qualified to be a physician, you take your board exam, right? Who writes the questions? Well, these are questions we're asking. How do you get to be somebody who writes the questions? Well, I have to go through a 100-hour training, but that's what you got to do. So now I'm going to get to write questions, right? But so we're working on various strategies of advocacy. I think we're getting closer, and we've seen many different boards. For example, the American Board of Pediatrics now has a continuation of certification module. So, every 10 years, doctors have to re-up. And now there's a module that they take about climate and health, right? So it's happening, piecemeal, it's happening piecewise. And, it takes a lot of advocacy, and it takes a lot of like constant pressure from a lot of different voices to make these changes happen. But trust that we don't sleep much, and we're working hard.
Do you think eventually it will be a requirement as time goes on within like the next decade?
Yeah, I think so. I would say this is, what you're working on, you're kind of leading this, at least in this country. And that's a space I'm really interested in. And I think that every year I have to make less of a compelling argument because every year more of California is burning down. Right? It is like it becomes increasingly apparent. And what I've noticed is that it is not hard to teach medical students and residents every year about climate and environment. The barrier is, how do we get often these older physicians who have not thought about climate change and health in their 50-year career because they were thinking about maybe the opioid epidemic or something else. And really part of it is it's almost faculty development, right? Because the barrier for me is it's faculty that's not comfortable teaching this. And so you kind of have to think about the entire pipeline and train all of them, and then diversify who's making decisions about standardized testing and that sort of thing. But Dr. Sorensen's doing it. She's.
And to your point, we're running massive courses around the country. We just trained 900 health professionals in North America, gave them continuing medical education credit, which they have to get, gave them a certificate in climate and health. The education was free. We had world experts. It was a 16-hour course. We're doing the same thing right now in the Caribbean region. We're doing the same thing right now with the Pan American Health Organization for all of Latin America. And we're going to keep taking over the world, continent by continent, and making this education available. Because again, it's like, if teachers don't feel comfortable, they're not going to teach it. And so we have to empower faculty. So it's like, we're seeing this really cool thing where, students often know more about this than faculty do, which creates this really funny thing. But, honestly, if we just sort of call it what it is and faculty and students work together, that's where the magic happens, right? That's where I think a lot of cool things can happen is with that collaboration.
And the factoid that I like to present to folks my age, I'm 46, and maybe sort of around my age or older, who are treating patients, is that half of the babies born in the United States this year will be alive in the 22nd century. Now, to me, I'm born in 1975. 22nd century seems like Star Trek. It seems like so far in the future. Half the babies born today in the United States will still be alive in 2101. Okay, life expectancy of birth is 79 years. So I hope that changes people's perspective. Be like, okay, it's not just about what is the environment right now. It's like, what is the environment going to be in 2050, 2080, 2100? Because we have patients today that our doctors are treating who are going to be alive in that time and are going to be experiencing the environment in that time. But, hopefully that changes people's perspective. It's like, oh, I need to think about this now.
Yeah.
Thank you. So on behalf of the Sustainability Committee, I would love to see amazing support from the Program for Writing and Rhetoric, in particular Steve Lemos, who is not here, but Linda Sita, Melinda Slaughter, and Kenzie Brownwater, without whom none of this would have been possible. Also, without whom none of this would have been possible, are amazing panelists. So if you will join me in thanking you.
It was really fun.